As I've said before, the Affordable Care Act is now causing very difficult financial problems for about 2% of Minnesotans who purchase their insurance policies through the individual market and are above the income eligibility for federal tax credits. The other half of those people in the individual market will find significant financial assistance by purchasing their coverage through Minnesota's health exchange, MNsure, and receiving federal tax credits, which will greatly reduce their insurance costs. Estimates are that as many as 100,000 Minnesotans who qualify for this financial assistance have thus far not taken advantage of it. It's crucially important that all Minnesotans who will be buying their insurance policies in the individual market first contact MNsure representatives, either online or by calling. MNsure is ready and able to help you. There's still an estimated 123,000 Minnesotans who need help to pay for their health insurance. They are individuals or families who do not qualify for federal tax credits. They are the people who need immediate help with next year's health insurance cost increases. Our administration drafted this rebate proposal with the following key objectives. One, we have to be able to start it and administer it under severe time constraints. Those realities greatly limit our options. Two, the program has to provide immediate financial assistance to people who would otherwise face excessive insurance price increases. And three, the program can cost no more than the amount of the additional surplus, currently estimated to be $313 million, which under current law would be added to the existing $1.9 billion budgeted reserve fund when the next budget forecast is released on December 2nd. Commissioner Franz, who is one of our outstanding administration team that has been working on this project around the clock in recent weeks, will shortly walk you through the handout we provided. I emphasize that this is a draft proposal subject to further refinement and discussion with legislators, insurers, and other experts. Also, if anyone has a better plan which meets the above three objectives, we are all ears. Basically, our proposal would provide monthly rebates in calendar year 2017 to people who are buying individual insurance policies and do not qualify for federal tax credits. They would receive monthly rebates of 25% of their insurance costs. That state assistance would in most cases greatly reduce their 2017 price increases. Overall, our rebates would reduce the 2017 rate increases from an average 55% increase to a 16% increase. And note that the rebate would be for 25% of the policy's costs, not just the 2017 cost increases. In these final days before the November 8th election, the Affordable Care Act and MNsure have been targets of repeated attacks by politicians, both in Minnesota and nationally, who have never supported those programs, who have blocked all efforts to improve them, and who are now trying to maximize their political advantages by trashing them. They emphasize the Affordable Care Act's current problems while ignoring all of its successes and hoping that everyone will forget them. So here are a couple of reminders. Because of the Affordable Care Act, all Americans, those covered by their employer's insurance, those on public programs, and those buying their individual coverage, either through or outside of the health exchanges, cannot be denied coverage by the insurance companies due to their previous or present medical conditions. That is a huge benefit to millions of Minnesotans and other Americans. They are among the citizens most in need of health care coverage, who before the Affordable Care Act could not obtain their needed insurance. Thanks to the Affordable Care Act, insurance companies cannot impose lifetime limits on people's health care needs. Before the ACA, citizens with chronic medical conditions would reach their insurance policy's limits and be left on their own. This practice was one of the principal reasons that over half of the personal bankruptcies in the United States were due to people's uninsured and unaffordable health care costs. Thanks to the Affordable Care Act, people must be allowed to keep their children insured under their policies until the age of 26. Young people, before the Affordable Care Act, many of those young people who were either in college or just beginning their careers went without any health insurance. If serious medical conditions arose, they were overburdened by unaffordable health care costs. The list goes on. Again, these are enormously important benefits to millions of Minnesotans and other Americans. They have saved countless lives and lifetime savings. The politicians who want to eliminate the Affordable Care Act rather than improve it fail to offer any comprehensive alternatives to it. Instead, they vaguely outline their same old bromides of, quote, free insurance markets and their versions of, quote, tax credits for those with high enough incomes to use them. Bottom line, they want to force us back into the same old healthcare mess, where we're all on our own, scrambling to decipher competing insurance policies, to understand the fine print that will later be used to deny coverage for unforeseeable health conditions, and to pay more and more for less and less coverage. The destruction of the Affordable Care Act would benefit some very powerful moneyed interests and their political allies, but it would create far worse problems for most Minnesotans and most Americans. But the Affordable Care Act must be significantly improved. It is essential that next year the U.S. Congress and the Minnesota legislature set aside their talking points and attack ads and work cooperatively together to solve these current problems and restore the promise of the Affordable Care Act to make good health care available and affordable for all Minnesotans and all Americans. I'd now like to ask Commissioner Franz to walk you through the handout, please.
Thank you, Governor. I'd like to first of all talk about why provide rebates for health insurance premiums. We believe this is the way to have the quickest, most efficient delivery of relief to the customers in this individual market. So as the Governor mentioned, any Minnesotan can go to the MnShare site today and can check on their qualification for the federal tax credit, and if so, then they'll know what's available for them there. If they find out that they're not qualified for the federal credit, then they can also shop around and see how much individual coverage is going to cost. But we believe that there are about 123,000 Minnesotans who will purchase their health coverage through the individual market in 2017, but who do not qualify for the federal tax credit because of their income. This target group are individuals and families who are unfairly shouldering the burden of this health insurance 50 to 60% increase in premiums in 2017. So who would qualify? The target group is really designed to target those folks who do not qualify for the federal tax credit. So for those folks who are individuals who make more than 400% of the federal poverty level, or $47,500 for an individual and $97,200 for a family of four. For these consumers who are not eligible for the federal tax credits, the rebate would automatically reduce their monthly 2017 premiums by 25%. It would apply just like the federal tax credit, so every month we'd work out a process where that 25% reduction would apply to their premium due every month. Overall, the governor's rebate reduces the 2017 tax rate increases from an average of 55% increase to a 16% increase. I'll show you some individual examples in just a moment. So how would you, if you're a Minnesotan in this group, how would you receive the rebate? Well, this rebate would be available to those Minnesotans who pay their monthly premiums to health insurance and they buy their health insurance on the individual market. The rebate would be administered by the health insurers who would receive state funding to reduce these consumers' monthly premiums by 25% in the 2017 premium projections. This is the fastest, most efficient way to keep more money in the pockets of Minnesotans who do not qualify for the federal tax credits. So how would the rebate be paid for? As the governor mentioned last Friday, October 21, the one-time 25% insurance premium rebate for 2017 would be financed with the estimated $313 million, which is scheduled to be added to the existing $1.9 million budget reserves this December. Let me just give you a couple of examples, and then obviously you can ask questions. So how would the rebates affect different premium scenarios? On the fact sheet that we handed out, we have a bunch of different groups. You need to remember that every time you go onto the website to search, you're searching both for your individual coverage, for the location of where you are, and for your family, whether you're a family of one or a family of four. So if you look just for example on the sheet that we handed out, this is an example of monthly premiums and how they would be reduced each month. So if you look at the top one, the family of four with two 50-year-old parents and two kids in Rochester, Their premium is currently projected to be $2,378 a month. Under the premium and under our rebate plan, that would be $1,784 instead, or a $594 decrease for that family of four. If you go to an individual, a 40-year-old in Rochester, for example, who would have a premium projected of $555 a month, that would be reduced by 25% to $333, or a $111 premium adjustment. And then the only other thing, the rebate plan would be based upon the silver, which is the second lowest cost premium, and you can look on that on the website to see how much that costs.
Thank you. Any questions on this subject? Yes.
You mentioned that the insurers would be administering this program. Have the insurers agreed to do this, or is that still being negotiated?
We've talked with them, with Mr. Showalter, their executive director of their plans, and we're meeting with him tomorrow morning to pursue that conversation. But we will need their cooperation, their assistance in administering this. The advantage for them is by reducing the costs of their coverage, we expect a lot more Minnesotans who will be able and willing to purchase these plans.
Does everyone get the 25% rebate, or does it scale according to income?
Well, given the time urgency and the difficulty, it's going to be anybody who applies for it through whatever mechanism we set up with the plans. It's not going to be dependent on income, which I regret, but it's just not feasible. Nobody has the data in place, neither the companies or MNsure, to identify people's income above the eligibility limits.
Only for 2017 or
calendar 2017. So that's what this program, $313 million would finance, and then, for the next legislative session, we'll be looking at all the options, as well as the U.S. Congress. Hopefully, will be doing so as well.
Governor, was there any talk about dipping in further into the reserve funds that are already in the rainy day fund, so to speak, to reduce these rates even further? To offer a bigger rebate on these monthly premiums?
Well, we dip further into it, but I don't think that's advisable, and I think the $1.9 billion that we've established, which is unprecedented, is a excellent bulwark against for unforeseeable economic downturns, which will eventually occur, and I don't think it'd be prudent to use any more of the reserve for this purpose.
On the exchange, the Affordable Care Act, the federal subsidies are based on the second lowest cost silver plan. So if you sign up for a more expensive, a gold plan or something like that, you don't get more subsidies. Would your plan work like that, or would it just be 25% of whatever plan you got, whether you got a silver plan or a gold plan? Or
It'd be based on the silver plan. So no matter what, that's the only premium reduction.
Same benchmark.
I'm wondering why you chose this option as opposed to the 10% cap that your colleagues in the House had proposed, 10% of income cap. Well, why this is a better way to go?
Well, we're, again, as I said before, the income determination is something that nobody is equipped to do. We're trying to put this together in the most straightforward way possible so people will receive immediate relief starting in January, and that puts us under severe time constraints and really limits what we have the capabilities to administer. We're open to any other and all suggestions, and we'll talk with legislators and others about them. There's some challenges in terms of both tax credits and that kind of approach that are problematic in terms of implementation and administration, and Commissioner Bowerly could elaborate, but there are a number of good ideas out there, and we considered a number of good ideas that we're just not able to implement and administer effectively.
So is it possible somebody who doesn't qualify, who makes too much money, qualify for existing credits, will pay less than somebody who qualifies for the credits?
Well, it's unlikely, but conceivably. Someone want to take that one?
It's unlikely.
From what I look at the calculator, if you're a single person with no kids at like 90% of poverty, you would get no subsidies. And maybe if you go just over, you could get some subsidies. But in most cases, if you have kids or multiple people in the family, it's
You're at 390%, you get no subsidy?
You would get the federal tax credit. You could get the federal tax credit.
You're saying that you're saying they would get no tax credit?
Yeah, which is not authoritative.
Credit who?
According to the Kaiser Family Foundation's calculator I'm looking at.
Well, go to the MNsure website and look at the calculator there, and
And also, this doesn't, but how does this affect people who have the huge deductibles we hear about and may not be able to get to a doctor in their area, may not be in network? Does this have any impact on those types of?
well, this will enable them to afford a better quality plan. I mean, because of the costs of these plans, and it's true within the Affordable Care Act, within those that qualify and those who don't, there's a economic pressure to keep going to lower and lower cost plans, which have higher deductibles, and that's not desirable in terms of making healthcare affordable in this country. So this would have, that allow them to be able to afford better quality plans.
Once the caps are reached, which I assume the caps stay like they are now, they don't have a choice.
Well, Blue Plus, I mean, we're talking about something into the future, and Blue Plus does not have caps, and they serve all but 5 counties, is that correct? 5 counties. So, I mean, people, and the plans are willing to work, and MNsure will work with people to help them find the most affordable available coverage. The caps are very real, but some people are really exaggerating the effect of that for their own political purposes. I think, MNsure will be working with everybody, and the plans are too, to provide coverage for those who want it and need it.
Following up on that, tomorrow, will you be asking the plans to increase the number of customers they'll accept?
Right now, we're going to focus with the plans on administering this program. That's a discussion we might have once they've had a chance to take a look at this and make their assessments and see how this subsidy, how this rebate would affect their calculations. We'll pursue that, but right now we want to get this plan in place so people know about it when the open enrollment begins November 1st. I might add also, I've been asking for constructive suggestions, and I received one just before I walked in here, so I haven't had a chance to look at it entirely, from Representative Greg Davids, who's recommending that we ask the CMS to extend the enrollment period in Minnesota by another month. And I'm inclined to say I would do that. I got to sort of check to make sure the other unintended consequences or whatever, but I really want to thank Representative Davis. That's exactly the kind of constructive suggestion to deal with this current predicament that I really welcome and appreciate.
Governor, it seems like everybody has a plan to set at the House, and now you got one. When are you ready to call a special session? When can we see that? Is it going to be November 1st?
I personally called all 4 of the caucus leaders today, and reached only Senator Han, who had a very cordial conversation. The other 3 I left messages and basically told them that they, or their caucuses, or their working groups, however they're setting up, can talk with Orrin Gilchrist, our staff, or any of our commissioners to get further details. And then they need to come as individual caucuses or working groups, however they want to set it up, and then as the House and then as the Senate, whether they can agree to this plan or whether they have another one that they prefer, and if so, we'll look at that. But I think it's got to be a ground up kind of operation now to make sure that 201 legislators, or at least a strong majority of them, are willing to support whatever they come forward with. And then at that point, when we have agreement on a particular plan, then I'll meet with the 4 leaders and talk about the parameters of a special session.
I talked with a couple of lawmakers yesterday, and they were telling me that they're not going to be back until after the election, so they're going to be really busy.
Well, we're all under that constraint, and that's just part of the reality. I would not foresee calling a special session until after the election. But I hope and believe we can get this agreement, if people are willing, again, to set aside the politics of this situation and work together. And again, if somebody has a better idea, welcome those thoughts. But to agree on something by next Monday is achievable if people put their minds and efforts to it.
Did I hear you correctly when you said that you were considering Representative David's suggestion of extending the enrollment period by a month?
We had to ask CMS to allow us to do so. But yeah, I mean, again, I just saw this literally 2 minutes before I walked in here. But I appreciate very much he made a constructive suggestion, and it's something I'm definitely we're gonna vet in terms of what the consequences would be if there are any that were not foreseen now. But otherwise, I would be strongly inclined to contact Administrator Savage and ask him for that extension.
Governor, if the state were to receive that approval, would it then be acceptable to wait until the regular legislative session to do this?
No, because people need to know where they stand. I think they need to know by next Tuesday when the open enrollment begins what this financial plan will look like, what it would be to them, and that there's enough of a agreement by the legislative caucuses that they can be reasonably assured that they're going to have that when January 1st, when these policies take effect. We could then have I believe we want to have a special session before then so people can, first of all, we got to administer the programs. We have to set it up quickly. So I would envision having a special session after the election, but relatively soon thereafter. But again, I need to hear from the 4 caucus leaders how they want to proceed, and their ability to reach an agreement is going to be the first step before we talk about special session.
Just to clarify, this would need legislative action to enact your plan.
Well, to give people the assurance that this will be the plan, that they can count on it and make their decisions accordingly. Could it conceivably go into, I don't even want to talk about going into the next session. First of all, the reserve money gets transferred to the surplus gets transferred to the reserve fund. Now it could be extracted from that, but so that is not prohibitive. But we need to know, and the Minnesotans need to know what the rules are going to be so that they can make these financial decisions accordingly.
So you want the agreement before next Tuesday among you and the legislative leaders, and then the session would be after the election?
I want the agreement before next Tuesday. I would like to have the agreement before next Tuesday from the 4 caucuses. And we've had leaders meetings all summer and early fall, and they didn't, we're not productive. I mean, this has to come from the caucuses. The caucuses have to decide individually and then working together, the 2 House caucuses, 2 Senate caucuses, if they can agree on a plan, this one or something better. And then when they have done so, then and if the House and Senate can concur, then we'll work with them. We stand available to work with them. But the ball's in their court now, and we offered a plan here. Somebody's got a better idea, fine. If they don't have a better idea, then we're either going to do this one or they're going to say we should do nothing at all. And so then we'll have to, face that reality. But if they all can agree, and if it doesn't occur by next Tuesday, it's not a deadline. I mean, that's when the open enrollment starts. So the sooner thereafter, the better, and then we'll proceed.
Basic question.
Commissioner Rothman address any of your efforts to boost access in those 5 counties without Blue Plus, or even those counties with Blue Plus that people are concerned about out-of-network providers?
So you're talking about 5 counties in the middle of the state of Minnesota. First of all, I believe, and I've said this before, that there's enough room in the caps that everybody in those counties should be able to get and will be able to get insurance. We have commitments to make sure that happens. At the beginning of open enrollment, they'll have at least 2 insurers to choose from, 3 or more in some other counties, and in those 5 counties. And to the extent they can, they should shop in those counties as soon as possible. I've urged that as well, and we'll keep a close eye on it.
When it comes to Representative David's request for an enrollment extension or waiver, is that feasible? Can you ask, are you talking with any of these plans about reconsidering, and is it even possible to get them to come back into the market?
Well, as to the first part is whether we can request an extension. We can request an extension to move the end date, yes. At this point, I would defer to making sure that we talk about the administration's plan first, and then we can get to the other issues as we go along.
Basic question.
I would just say that, within the parameters that have been established, this administration and MNsure, starting with Allison O'Toole, and the plans, we don't know the details, are committed to working to make this period of time as trouble-free for people, as affordable for people, to work out their individual situations. Minster's ready to be responsive on a timely and effective basis starting November 1st. And, you know, there are a whole lot of us, most of us, who want this program to work as well as possible, while recognizing its defects. In contrast, there are those who just want to focus on the defects and exaggerate them and make it sound as though this is, you know, a cruel government who's trying to come in and try to just rigidly enforce this and make it as difficult as possible for people to get through it. So, you know, that's not that. Fortunately, they're not in charge of the executive branch of Minnesota state government, and we are, and we're going to make this work as well as possible.
Proposed rebates dependent at all on where you buy your insurance, whether it be from the exchange or off-market from the plans directly, or does anybody who buys an individual plan?
Well, I believe anybody who buys an individual plan through MNsure recognize that they won't qualify for the federal credits or outside of MNsure.
Can you apply for both? I mean, can you get both the federal credits and the state rebate? No, just one or the other, correct?
Correct.
Thank you.
That would be up to the plans to figure out the mechanism to make sure that people don't double dip.
Again, I'm astounded that 100,000 Minnesotans who are eligible for federal tax credits now 4 years into the program aren't taking advantage of them. I mean, that's just, you know, all of those people, and we'll do everything we can to, you know, through whatever publicity we can generate, they should be going to MNsure, and if they qualify, they should be purchasing their policies accordingly and qualifying for the federal tax credits, because if they're not, they're paying more money now for the policies even before any of these increases than they needed to. So I you just realize modern advertising says, what, you have to tell people things 17 times, I think it is. I always look at these ads and say, why are they doing the same ad in the next hour and the next hour? But, you know, they realize that you just got to reinforce that point, and we don't have the resources that Coca-Cola does to reinforce the point every other hour. But I hope people will become aware of this. I hope the health plans, we're going to ask the health plans to help shepherd people, guide people into the Affordable Care Act who can take advantage of those credits.
Are you going to require anybody who files for the rebate to check first to see if they qualify for the
We don't have a mechanism to do that. If the extent the plans can help us do that, and we'll talk about that tomorrow and following. But again, you know, that we don't have an income eligibility floor determination and a mechanism to do that exactly. But we're going to push very hard, because we don't want the state to be paying for something that the federal government is already set up to pay for.
But you are looking into it.
We are pursuing with the health plans, starting with Mr. Showalter tomorrow.
Governor, I suspect that Speaker Dowd will say you should have this plan ready to go last summer when you knew that Blue Cross was pulling out and the rest of the plans wanted to do the same. How might you respond to that?
Well, we didn't know what the other plans' rates were going to be until the fall, and you know, in hindsight, should we have moved faster? I mean, I don't know. I mean, we moved as rapidly as we knew the scope of the situation, and it's always easy to sit on the sidelines and criticize, especially by people who haven't lifted a little finger to make this situation better and deal with some of the changes at the state level that could have relieved some of these problems. And same with people at the federal level who absolutely blocked any of the improvements that could and should have been made that would have reduced these problems considerably. So, you know, sit on the sideline, and they want this to be the focal point. I raised the issue yesterday on transportation, and the speaker says a clumsy attempt to try to shift the discussion away from the healthcare. Well, they want the discussion to be entirely about the healthcare. They want it to be entirely about the 5% of people who are affected by this, and avoid talking about any of the benefits that I just described for the 95% of Minnesotans, and even those 5% as well, who have access to coverage that they wouldn't have had otherwise. And they don't want to talk about anything else. They don't want to talk about the fact they're blocking $100 million, $105 million of transportation money and anything else, because they see this tactically to their political advantage. And that, frankly, is the big hurdle that we'll have to see if we can get over and beyond in order to reach, provide this assistance to people, is whether they're willing to park the rhetoric at the door and sit down and solve problems, as Representative Davis suggested doing.
Is there any way that this rebate would be construed as federally taxable? I know that's been an issue in the past when the state has delivered rebates as to what kind of rebates it gives out.
Following?
We'll have to consider that, but I think it depends on how it's structured, though it would not be.
Okay, thank you very much. Anything else? Halloween costume? Come dressed as yourself else.
Sales tax rebate, so it wasn't taxable.
No, I'm going to Chad Greenway.